Hello, this is Kim Jong-il. Today, we will have a lecture on the classification according to occlusal planes. In our previous lecture, we said that Class 2 is closely related to step POP and Class 3 is closely related to flat POP. We also studied that deep bite is related to steep UOP and open bite is related to flat UOP. The treatment method is to allow the steep POP to be flat and the flat POP to be steep. You can also adjust the steep UOP to flat UOP and the flat UOP to steep UOP. The UOP can be divided into flat UOP, normal UOP, steep UOP. And POP can be divided into flat POP, normal POP, and steep POP. Especially, steep POP is important. If the patient shows flat UOP as a steep POP, there is a high possibility of open bite. And there is a high possibility that it will be a Class 2 malocclusion. In other words, the Class 1 open bite, Class 2 open bite, and Class 3 open bite can all show different aspects. Let's look at the patient. The anterior shows open bite and the relationship of canine is half Class 3. UOP 5.9 degrees flat UOP, POP 10 degrees normal. These are ODI 70, APDI 85, CF 155. Let's look at the next patient. The relationship of canine is half Class 3 and the anterior is open bite. The UOP is 10.4 degrees normal UOP, POP 9.1 degrees. The APDI 91 shows the skeletal Class 3. In this case, half Class 3 relationship UOP is 15.4 steep UOP. The APDI is 92 with a skeletal Class 3. Should the treatment be the same? Let's look at this patient show the half Class 3 relationship. It's Class 3 with APDI 86 UOP 11.2 normal UOP, POP 15.9 steep POP. Each patient's occlusal plane is compensated. And it is important to understand how the compensated of upper and lower anterior teeth and upper and lower posterior teeth. This patient is half Class 2 relationship. It's an APDI 74, skeletal Class 2. UOP 12.9 normal UOP, POP 24.9 step POP. This patient is steep POP, which causes the mandible rotate to backward and protrude. This patient is also a half Class 2 relationship. The protrusion is shown, and the APDI is 72, which is a skeletal Class 2. UOP is 18.4 steep UOP and POP 20.4 steep POP. The anterior teeth of the upper is extruded, and the mandible is rotated backward and shows more severe protrusion. Should we treat similar of open bite in the same way? It would be desirable to treat it differently. This patient is open bite of skeletal Class 1 with APDI 81. UOP 8.9 normal UOP, POP 10.8 normal POP. This patient is open bite of skeletal Class 1 with APDI 83. UOP is 10.6 normal and POP 15.2 steep POP. In other words, it is recommended that the normal UOP be made a little step UOP and the steep POP be made flat. This patient is a PDI 83, skeletal class 1. UOP 15.4 steep and POP 18.9 steep. What should I do with the treatment? Steep UOP should be intrusion method if possible, and it is recommended to change the steep POP to flat POP. Even if the diagnosis is similar, the treatment method may vary. Summarize it. You can see that even Class 3 open bite shows various types of UOP and POP. The same goes for Class 2 open bite and Class 1 open bite. These are deep bite patients. In the case of A, you can see the steep UOP and steep POP. B shows normal UOP and flat POP. The deep bite condition is observed similarly, but the condition of teeth is different. She shows a similar deep bite, but the UOP is 23 and the POP is 26, so the UOP and POP are all steep. There are a lot of open bite in case of Class 3, however. Some cases may show Class 3 deep bite. If you look at this patient, you will see normal UOP, steep POP. The same is the Class 2 malocclusion. Depending on the occlusal plane, it may be normal UOP, normal POP, or normal UOP, steep POP, or steep UOP. In summary, the open bite shows flat or normal UOP depending on the occlusal plane. At this time, maxillary posterior teeth is extruded and POP is steep. On the other hand, for Class 3, the posterior teeth of the upper is extruded, showing flat or normal UOP, while the mandible move forward and show normal POP. In case of deep bite, the upper anterior teeth are extruded. The UOP is normal or there is a possibility of steep. Normal POP is highly likely because the vertical dimension of the posterior area is sufficiently grown. On the other hand, for Class 2 malocclusion, the normal UOP and step POP are often shown. Of course, there are some cases that are not. When we want to treat various malocclusion, there will be a limit to treating them only by looking at the occlusal plane. First, it is important to evaluate the skeleton of individual patients, which can be evaluated through ODI, APDI, and CF in triangles formed by the palatal plane, AB plane and mandibular plane. Depending on the different skeletons of the patient, the compensation of the upper, lower teeth is different, which can be evaluated through the occlusal plane. Therefore, we need individualized orthodontic treatment of the patient, which requires first looking at the skeletal pattern and evaluating what kind of occlusal relationship and occlusal plane it has. Again, we first measure ODI, APDI, CF to get an idea of the overall skeletal pattern. The angulation of the palatal plane and the ANS should be determined from the minus values on the upper side and the plus values on the lower side. And the evaluation of the slope of the occlusal plane should determine how the mandible is rotated and what kind of malocclusion it shows. Thank you for watching.